Hello, I'm Dr. Teena Thomas, obstetrician and gynecologist for Shashi. First thing I would want to say that Shashi was an excellent patient. Basically, it all depends on how you are and understanding and how you gel well with your gynecologist to move on, because the journey is for 9 months, not 2 days. So everything has to go hand in hand to understand each other better to have a good outcome. Now about Shashi is a very trained yoga person, and she's been doing exercises since long. She's not an amateur who just started it off or anything. So she has been doing it, and hence I was confident that she will continue to do it properly. Now whether you can do it or not. See, the basic thing is, if 100 women get pregnant, 80 only continues, 20 will miscarry. That is the norm of the world, nature. Okay, out of this 20, 15 miscarriages in the first trimester, balance 5 miscarriages in the second and third. Now you imagine, if God would have made these 15 to miscarry in the last trimester, how bad the pain would be in this world. So God has made it so beautifully that those pregnancies which are abnormal or which may not be able to fend for themselves most of the time, the God's own way to take them away in the first 3 months. And that is not because of your exercise or your eating anything or your working or going to office or doing anything like that. There are some patients who have high risk pregnancies. They may be having bleeding, they have multiple miscarriages before, or they have any medical disorders which had started pre-pregnancy, and then you are little more careful and then you have to monitor. So each and everything tailors to the need and necessity of the patient herself. So now the most important thing, so if a person is doing exercises, so all those patients who are playing badminton, they continue to play as pregnancy comes in. We do not stop them to play badminton just because they are pregnant, unless high risk your doctor decides. So otherwise, those who have joined, those who do strength training, those who do swimming, those who play badminton, or any form of exercises which they have already been doing, they continue in pregnancy. Now, if a person who is not doing anything and I ask them to just walk for 20 minutes morning, evening, that also is difficult. I can't ask them to do what Sashi did or any other person does like that. So, if you are already trained and you've been already doing those exercises, it is best to continue that so your body acclimatizes and adjusts to the same things in future. Because when the pregnancy happens and your body grows bigger, the blood gets thicker, there are so many changes happening in the body, and so you need to build up your stamina to carry on this happily. You can also carry on crying, lying down, cribbing. So that is one way of continuing. If you want to continue like Sashi did, then you have to have a positive attitude, a good diet. And so if you have to do what she did, you have to have a high protein diet also. So you have to have a good diet, good exercise, and a good attitude to continue. Example is Shashi here, the biggest example in front of you. So one more I'll give you of Serena Williams. She played Wimbledon and won it at 11 to 12 weeks. So if she has to win a Wimbledon at 11 to 12 weeks, her practice must be of almost 15 hours in a day of Wimbledon, not badminton. So that is a strength every woman carries. You have to understand your body. You have to be exercising before. So all patients who come for a pre-pregnancy counseling are already told to have a 1 hour of good exercise, which we will continue in pregnancy. And about these yoga movements like the back bending and all that, see, uterus is a nice thick organ, and it is covering the baby completely. So when you bend backwards, the uterus does not bend the baby. Uterus is in its position straight. Okay, your back is bending, so that does not bend the uterus. When you bend forward, it is bending at the pelvic area. So at a lower pelvic area, the uterus does not bend into half. So when the uterus is not bending into half, it is protecting, no, completely covering the baby and covering it. So it does not. Now the thing is, if you give a one big mukha on your uterus, ideally the God has created the uterus so nicely that if you give one big nice punch on the tummy of a pregnant woman, ideally the uterus will take care of the baby and does not reach the punch to the baby. So that's how the uterus is covering. So when you bend backwards and when you bend frontwards and all your Sirsashna, she used to stand on her head. So all that does not hamper the baby. Baby does not know that the mother is standing on the head, no. So baby is in a covered environment. You go into the swimming pool. You go into the swimming pool. And the outside the swimming pool, if you burst a bomb, the baby, you inside the pool does not hear it or know it, right? Because you're covered in a water and the pool. The pool is open. This is a uterus which is completely covered. So it does not. But only in trained hands. You can't start it now. Since Shashi did it, so now I am pregnant, so tomorrow I am going to start it. No. You have to start it pre-pregnancy and train yourself well. That is all. Thank you very much and a very congratulations to Shashi.